My name is Adeyinka Adefolarin, a Cohort 3 CARTA Fellow, and the title of my presentation is Primary Healthcare Mental Health Outreach and the Emergence of Community Social Support System. This study describes the social support system which emerged as a result of mental health service provision routinely to the community by the mental health team of University College Hospital. And here is the question: can this mental health outreach address barrier to mental health service uptake identified in literature? These are the barriers to service uptake: non-affordability, lack of access, stigmatization, lack of understanding of effectiveness of mental health service, and length of waiting at the tertiary service, the facility where this service is largely available. People come from all over the city to the tertiary facility to access the service. And the method we adopted a qualitative design and a one-year record review of social case notes of patients from 5 primary health facilities. And we utilize interviews and focus group discussion among patients and caregivers. Here are the results. All responses from focus group discussion show that cost is saved, there's less waiting time, and they said they were able to receive better attention from the mental health team. And they said there's less hospitalization, they rarely relapse, and they don't feel any stigma, so to say. And one of the caregivers, a 74-year-old man, said that he normally brings 4 members of his family who are patients to the hospital. And now that the service is accessible at the primary health, it becomes very, very easy for him to bring them. There's ease of support. And according to him, he can even take care of more patients now. This next slide shows the sources of social support and other results. These sources of social support, they emerge on their own without prompt, without activation, without advocacy, nothing except provision of mental health service at the community, which involve consultation, medical consultation, counseling, and health education. We can see on the first column the primary health centers, and the second column shows the sources of social support. We can see the clergy, the church, the clergy, Islamic clergy, Christian clergy, the primary healthcare staff coming together to take care of patients, the landlord association coming together to take care of patients. You can see the number of patients they are taking out care of and the type of support they give. And the cost of care. The cost of care involves the medication. If it's tablets, it's around 3,000 to 4,000, which is almost $2 to $3. And the cost of consultation and transportation could amount to $3 also, making $6 in total. And the last column shows that that cost of consultation and transportation is safe because it's near to them, and at the primary health center there's no consultation fee. And we now look at the research question: can the mental health outreach to the community, to the primary health care, address barriers to mental health service uptake, which are non-affordability, non-accessibility, stigmatization, long waiting time, lack of knowledge about effectiveness of mental health service? We can see from this result that these results address the barriers. It leaves us with another question: that could lack of uptake to mental health service in the community be due to cultural belief or lack of access to mental health care? This is a question for further research. Thank you.